Bismillahirrahmanirrahim. It's a pleasure to be here addressing this very august gathering. I'm very thankful to our president, Professor Kashif Malik Sahab, and my very dear senior vice president of the Society of Hepatology, Dr. Asad Chaudhary, and Zishan Sahab, and many other colleagues, Dr. Huma and other colleagues and provincial government, colleagues, national government colleagues, and friends from the private sector. Today, I'll be very, briefly talking about the topic that has been given to me about public-private partnership on hepatitis elimination in Pakistan. And I'll just begin with the fact that, how much has been invested and being invested by through USAID and Government of Pakistan, Supply Chain and Digital Corporation in Pakistan. I mean, although we worked very closely with the government in 2020 when we actually worked on forecasting and quantification and business forecast for the industry, I would like to take your attention to some of the very important areas that we have been addressing under this partnership with the government of Pakistan. So, um, Friends and colleagues, ladies and gentlemen, USAID is working on many aspects of supply chain and digital cooperation with the government of Pakistan. And relevant to the topic today is basically more on the infectious diseases. We are working on the Vaccine Logistics Management Information System, that was the DLI-4. And based on this, the government of Pakistan actually monitors the performance of the EPI program in Pakistan throughout 160 districts of Pakistan. Um, and then AIDS, TB, and malaria and other areas, we have been working on global health security. We have been working on immunization, family planning, and, data hosting and data security solutions for the government. Recently establishing a data center at the NIH that will actually look after all the infectious diseases data of Pakistan hooked onto one platform, and that will improve governance, accountability, and management planning, coordination, and financing for infectious diseases in Pakistan. So I'm very closely coordinating with Dr. Amir, Professor Amir, and colleagues at the NIH, and of course, provincial governments and CMU addressing AIDS, TB, and malaria. And we started with, hepatitis control programs throughout the country back in 2020, where EMR of Punjab was being looked at as to how we can actually replicate this for the entire country in terms of bringing visibility to the hepatitis data. So it's a lot that we are doing, not only with the public sector of Pakistan, but also academia, where we are actually designing and deploying and training faculty of many universities like University of Health Sciences Lahore, University of Balochistan, University of Peshawar, Dow, University of Health Sciences, and some other universities, Health Services Academy, where we are actually injecting the science of supply chain management for infectious diseases in the country. Now, coming back to, I think very beautifully, the title of today's conference actually describes what does it mean in terms of the private sector, the scope of the problem that we see in Pakistan to be addressed in terms of the partnerships that we need to roll out actually. I mean, I think there's a lot going on. Industry has a lot of stake and commercial advantage, as well as public, service in Pakistan, where, the diagnostic industry and the therapeutic industry in terms of producing 3 and 6 months, courses in Pakistan, it's a huge, huge undertaking. And I think we need to see beyond, normal visibilities, and it has to be out of the box thinking to see how we can convert the possibilities of that huge business forecast into a commercial industry cooperation, which leads into long-term agreement or local production from the private sector. So that is one thing that is very important for Pakistan, and I think we need to take this and prioritize this. And Pakistan Society of Hepatology can play a very important role in this regard. Now, coming back to a population of more than 225 million people in Pakistan, with 120 million people needing screening for hepatitis, and then estimating, I think some of the predictive analysis that we have done with, Dr. Huma and other colleagues with Al Khan and, yourself and many colleagues sitting here, highlights, the scope and quantum of the issue actually. So of those 225 million, 120 needs to be screened, and those to be screened, 11 million seemingly will be positive on PCR. So rapid testing kits, and then the PCR, or gene expert machine using all those technologies that are available in Pakistan, and then the same population, about 9.8 million people of Pakistan, will be needing that requirement of some kind of treatment. Now, based on this, I think this itself is a quantum and forecast, and a knowledge that gives us that what is going to happen and what is happening in Pakistan, and how we need to convert the disadvantage to advantage, both from a public health interest and also from a public-private partnership perspective to commercial sector or the diagnostic industry operating in Pakistan. Now, coming towards some few key messages that I would like to give of this, the hepatitis elimination program, hepatitis C elimination program, more particularly, and of course hepatitis B and other variants as well. But just looking at the quantum of the hepatitis C, I mean, I'm very thankful to my colleagues, Dr. Samuel Attareen from Punjab, Lahore. He has been playing a pivotal role in shaping the PC1 of Pakistan. Dr. Uma has spoken about it, and my other colleagues, where we actually quantified the public health quantum of the issue. Uh, it tells us a story, actually. I think, in my view, this USAID and Government of Pakistan collaboration in terms of forecasting the business of HIV, HCV elimination in Pakistan itself is a big story. This is one of the best PC1s that I've seen over the period of time of my 30 years service in public health, both in Pakistan and abroad. So the reality is that 95% of the 74 billion rupees PC1 required for the next 5 years, just to undertake 50% of the disease burden, to look after about 69 million screening, about 5.5 million getting positive on PCR, and then of those about likewise about 4.5 million treatments, actually. So this is a huge task in terms of dividing the public-private partnership into phase one and phase two. Phase one taking 50% of the burden, and then another 5 years taking the rest of the disease burden, and aligning and learning from what we have done good and what we have done wrong, and moving forward. Now, just to give you a snapshot of this 74 billion rupee forecast, what we see is that 95% actually goes to the industry. And that 95% is either rapid diagnostic testing kits or testing kits for the PCR, or these are the treatment regimens for, regimen for, 3 or 6 months that actually constitute 95% of $74 billion rupees, actually. So this is a huge business which is already in action, and the private and commercial industry is taking full advantage of the disease burden in Pakistan in terms of providing those services in the country. Mainly, three companies that are operating very efficiently, and more than 48 companies which are actually producing some, therapeutic products in Pakistan. Now, I'm sure Dr. Asad will be able to, share my presentation with you that gives you also not only the national, disaggregated distribution of the investments that we foresee in the next 5 or 10 years. We have also provincialized those investments in terms of how different provinces and regional governments will be looking after their business on the disease burden. So, my dear friends, ladies and gentlemen, we also have a provincial, business forecast, and that has a very particular share of the Punjab, Sindh, Balochistan, and KP government, along with the regional governments. Now, coming towards the end of my talk, when I say that 95% of the 74 billion rupees, which is already in one or the other way action going on, rapid diagnostic testing kits, it is not as formal as we would like to see, as my worthy colleagues know that this PC1 is still hanging somewhere, and as soon as it is approved, then it will actually materialize the execution of the money in terms of realization of the diagnostic and therapeutic courses for the people of Pakistan for the quantum that I just described to you. But I think three or four messages that I would like to end my talk with is: number one, that Pakistan Society for Hepatology, along with other major stakeholders working on hepatitis, can play a pivotal role. And I would urge and request my dear Dr. Asad and Kashif Malik sir to take that leadership role in terms of bringing all these stakeholders in doing three important tasks actually. One, that we need to design and deploy a corporate engagement strategy for diagnostics. We know that Pakistan has gained quite good strength in terms of 48 companies producing one or the other, hepatitis elimination drugs. But this has to go to the diagnostic side. And when I say diagnostic side, my second, not only that we need to develop a strategy, the second action item is basically, Pakistan Society for Hepatology and other relevant stakeholders can actually bring market drivers on the table, and these are Abbott, Roche, and Cepheid, to talk, with the Ministry of Commerce and Trade, Board of Investment, Securities and Exchange Commission of Pakistan, Ministry of National Health Services, SCP, I mean, all these stakeholders to see how their commercial advantage should be protected, both in terms of having a win-win relationship. So not only that, these companies are driving a lot of business, but also contributing as a social and corporate responsibility to start thinking about producing or getting into long-term agreements with the government of Pakistan for, buyback guarantees for, local production of these, kits in Pakistan. I think that is what the best, I think, the public-private partnership we can materialize actually. My last point, and my request, humble submission, to all of you, most importantly to Pakistan Society for Hepatology, is basically to bring, Pakistan PPMA and Pharma Bureau on the table to see how their, interest in Pakistan, can be seen in terms of getting the diagnostic industry, moving forward. My last point would be, that I think IMS and IQVIA have been playing a pivotal role in shaping markets and understanding markets, and that knowledge is very important. And I'm sure, some colleagues there are known to us. We need to also see that how much of the business Pakistan is actually creating for the industry, and what does it mean in terms of that corporate social responsibility, and that long-term agreement signs that actually can be materialized between the commercial sector and the government of Pakistan. With these words, I am again very thankful to my colleagues at the Pakistan Society for inviting me to give this talk, and I wish you a very good inauguration. And I'm sure this is the beginning of a larger piece of advocacy that will lead Pakistan towards partnerships beyond feasibilities, public-private, commercial sector partnerships that will ensure that we are reaching out to maximize the advantage to people who are suffering from hepatitis in Pakistan. With these, ending words, I thank you again. Uh, Thank you so much. Good night.